So because there are so many things out there, we lumped all the medication things into pharmacology, because this is just an area of treatment that you need to be aware of, think critically about, look at what's happening. There is a lot of research coming out about it, and because there is a research base in the use of these medications with people with other conditions, and we know the effectiveness of those, then we look at it as possibly promising for kids on the spectrum. The difficulty that we do see happening is the age at which the medication typically was used with people, now using it with kids, and that doesn't have the research base, or the side effects. This is a big thing that especially parents have difficulty knowing what to do about the side effects, because there are, sometimes tics, appetite suppression, growth suppression, and then you can also have some medications that actually cause depression and anxiety and not alleviate it. So you want to think about those things, especially when you have a child with autism and their brain is already doing different things than the typical brain. What's going to happen when you introduce that medication? So these are all the different things that we already know. We already have medication for all of these. There is no medication yet out there for social and language impairments. We have anti-anxiety medication that we give to people who have social anxieties, which helps them to be able to do better at interacting socially, but it isn't something that gives you the skills to interact. So that's the one area but it's been very helpful, especially with aggression and self-injurious behaviors. That's one area I have been very thankful for medication sometimes when we have tried so many types of interventions, and that's something that's so harmful, and you want to figure out how to stop it. The other thing is the medications typically used for kids with ADHD. We have seen a lot of really positive results with our kids on the spectrum and helping them attend, helping them to be less hyperactive, and to do better. But I always, come from the philosophy that don't first try medication. You want to try interventions that have a database to them so that you can follow through, you can know what's happening, you can see the progress, you can actually see, now that they're learning, where do we still have those difficulties with them, with their behaviors and things that are going on. Because you always want to try one thing at a time. You never want to try anything simultaneously, because then you have no way of knowing which one is being effective. So you want to try one at a time. So you want to be able to first start your behavioral educational interventions and then understand, okay, this is what's happening, we have the data, now let's try this medication and then see from the data that we take after that what's going to happen. I do also I get upset when parents start medication and don't tell anybody else. We have a lot of problems with that, and I really talk with parents a lot about, please don't just use us as your experiment to see what we say. We need to all know, because it's very important for us to understand, because there are side effects, because something could happen. Seizures are a side effect. And we also need to be taking data, and we need to be part of that database driven decision making from the beginning so that we can do that. So that's kind of what's happening with that.